Welcome to another episode of Plastic Surgery Uncensored. I'm your host, as always, Dr. Rady Rahban. So today, or this week's episode actually, is about buccal fat removal and buccal fat. So in plastic surgery, we have big procedures that do major things, and then we have these smaller adjunctive procedures that people don't necessarily know about. Maybe they're not as common. They're maybe more subtle, but they are relevant. And then every once in a while, because of the era of social media and internet, things go viral and they get way more attention or are being done way more often than they need to be. So I think buccal fat is one of them. It kind of falls in the same realm as a lip lift. So let me tell you what the buccal fat is. So in one's face, in the cheek area, but not at the high cheek where the bones are, but right underneath the bones, if you take your fingers and drop right underneath the bones, you'll find you get into a little pocket. My face doesn't have one because I'm quite narrow, and that is called the buccal space. And in that buccal space is a pocket or a collection. In that space is a pocket or collection of fat. It's kind of almost the equivalency of an egg yolk. It's very well defined. It's a very specific type of fat, and it's very finite. What do I mean? Oh my God, my face is so fat and so round, I must have a huge buccal fat. No, could be small. Oh my God, my face is so skinny and so narrow, I must have a tiny buccal fat. No, it may be huge. So it doesn't necessarily correlate. Nevertheless, it is a very finite amount of fat in its own pocket. Okay, so what is that of any relevance and why does it matter? So aesthetically, we tend to like faces that are a little bit more chiseled or a little bit more refined. And in general, we don't like our faces to be very chipmunky or very full on the lower half. Yes, it is beautiful or attractive or desirable for our cheek bones and the upper cheek and the zygoma and the arch to look full and strong. But if you think about how we contour makeup, you kind of put on blush in the midsection of your face so that it looks a little hollow or more defined. And that's actually where you want to be thinner. And in some people, their anatomy is that they're just full and they're very cheeky, okay? So, well, I'm pretty skinny. It's not just because I'm overweight. My face is just round, which in and of itself isn't a problem. But if you want a more chiseled face, you're just stuck with it. Well, can I just liposuction my face? No, you can't just go around liposuctioning your face like you can liposuction your love handles because there's nerves and arteries and all kinds of really valuable things. So you're kind of just screwed and stuck. Well, not exactly. So what you can do is you can go inside the mouth, right around where your second upper molar is, and in that mucosa of your buccal space inside your mouth, if you make a small incision and go straight down through the muscle, you're going to go pop and enter the buccal space. And when you enter the buccal space, there will be this egg yolk type fat that you can tease out and remove. And what will that do? In the right patient, that will make the middle area of your cheek seem a little bit hollower, hence a little bit more sculpted, hence maybe more attractive. So that is what the buccal fat is. That is why it's of value, and that is how we go and get it. Okay, who should be doing this? So first of all, the very, very, very important is that not everyone should be doing this. Why? Because you're removing something that, while in some instances is not desirable, in other instances will be desirable or may be desirable. So one thing is for sure, as we age, 20, 30, 30, 40, 40, 50, 50, 60, we get sagging and we get hollowing. Sagging we all understood and we knew, facelift. Hollowing we didn't really understand until the last 10 to 15 years. We actually lose fat. If you look at your grandmother, she's usually hollow unless she's way, way overweight. And if you look at my son or my daughter, they're nice and cheeky and fat and fill in the face. So we do get hollower as we age. And so as a result, you need to be careful what you remove when. So historically, this procedure was very judiciously done. It wasn't done that often. But today, because procedures go viral and celebrities start doing them, we have like 22-year-olds calling our practice wanting to do these sort of esoteric type procedures. So who is a good candidate is somebody who is full-faced, very cheeky, and likely to remain full and fat-faced as they age. And therefore, removing a little bit of that buccal fat when you're younger isn't going to make any dramatic impact as they get older. Who shouldn't do this? Someone who's regular-faced and wants to have that sort of gaunt model look. And while if you do it and you're 25 and you go from being regular-faced to gaunt and model look and you like it, when you become 45, 50, you may be way too hollow. So it's very important. And you can go online, Google buccal fat removal, and see hundreds of celebrities with terrible outcomes because they were people who were not truly good candidates. They were people that were regular-faced people. They transiently wanted to look a certain way. They removed their buccal fat and it made an impact. By and large, it's not a very dramatic transformation. In other words, if done in the right person, hi, I'm a young person, my face is really round and full, I often have a weak chin associated with it, and I wish I had a little bit more chiseled or angulated look, and you remove that fat, it's going to be subtle, right? It's not going to be like, oh, whoa. It's only when you do it in someone that shouldn't be doing it and is a bad candidate, you're like, whoa, what happened to them? They removed too much, okay? Now, how it's done, it's very simple. It's a 1-hour procedure. You go inside the mouth, you numb up the mucosa, that is the shiny area inside your mouth. You make a small incision, maybe a centimeter and a half. It's really not that much. You literally go down. There's a muscle there. You spread the muscle and you go pop, and you literally enter a space called the buccal space. And then you'll immediately see the fat, and the fat just sort of oozes out. You should remove, or a surgeon should remove, whatever comes out easily. You shouldn't be digging and going and trying to get every square inch of fat. Why? Because you're now near all the facial nerves. You're around all the plumbing of the face. You're inside the face proper, and there's a lot of important anatomy in there, so you don't want to be going too crazy while you're in there. Okay, great. So now I've done this thing. What do I expect in terms of recovery? Actually, the recovery is probably one of the easiest recoveries in plastic surgery. The incisions are hidden. They're inside your mouth. They're done with absorbable sutures, and they're going to absorb. You want to obviously stay away from really like high viscous foods. You don't want to be doing this procedure and then be having like a caramel candy apple. You don't want to be having a ton of tapioca or things that are sticky. You want to have what's called low residue food. Food that doesn't leave a bunch of residue behind. You just want to eat your food, wash your mouth with some water, at least for the first 7 to 10 days. There's relatively little bit of swelling because remember, you swell, but then you remove the fat. So to be honest with you, you should kind of look like nothing ever happened. And then you can expect that over the course of the next 2 to 3 months, that area will very gradually and incrementally go in a little bit and create perhaps a little bit of a more hollowed or modeled type look. Now, I would say that the overwhelming majority of people will not notice what you're talking about. Again, if you're the right candidate. You will, but most people won't. Other than that, there's really not much to the recovery. It's quite a simple recovery. So naturally, no procedure is without its risks, and buccal fat is no different. So let's talk about the risks. Other than, bleeding and infection and all those things, obviously there's essentially no scar, right? Because it's inside your mouth. The one that we worry about most is nerve damage, right? If somebody goes in that space and doesn't just allow the fat to passively come out and starts really going in there and starts looking for it, they're going to obviously cause nerve damage. That can be transient, or worse, that could be permanent. So that's very avoidable. 2, you can get asymmetry, like what if you inherently have more fat on one side than the other, or the surgeon removes way more on one side than the other? That's not ideal. You want to remove essentially the same amount out of both sides, or if one side is worse than the other, take that into consideration. And lastly, and by far probably the thing that's most concerning about buccal fat, and probably what has brought it to the attention of the general public, is overcorrection. Like everything else, I did a whole episode on lip lifts. When people hear of a procedure that's quick, easy, affordable, why is it affordable? Because it's not that big a surgery. Then all of a sudden, everyone's running out to do it, right? because who the hell doesn't want to look like a model? And next thing you know, it's overdone and you're having all these bad outcomes. This never was the issue 20 years ago because it wasn't popular 20 years ago because it was only done in people that were appropriate. So overcorrection is the main issue, which is I go in there, I don't really need it. My surgeon is unscrupulous, doesn't tell me I'm a bad candidate, remove the fat, I don't know, a year or 2 years later, all of a sudden I have a hollowness that doesn't look natural or desirable. Now I'm dealing with filler and fat transfer and all this other crap. And it was avoidable from the very beginning. So I hope that in general is very helpful regarding the procedure. It can be done under general or conscious sedation. I don't really recommend it doing under local, even if your surgeon says they can do it. And I think it's a really useful adjunct in the right patient population. So if you're contemplating it, I hope this helps you. Just be careful and make sure you do your homework. All right, guys, that's an easy, quick wrap. That was a quick episode. So I've been told that instead of asking you to share, I'm supposed to ask you to download and subscribe to our podcast, right? We want you guys to enjoy our episodes, and moreover, we want more people to be able to enjoy them. And the more you download and the more you subscribe, the better our podcast does. And lastly, go write something nice. It really helps us. It makes everybody enjoy the podcast experience. We have a lot of people putting in time behind the scenes. And usually you're like, I'm gonna go write something. And then all of a sudden your kid's screaming and then you gotta run out of the door and fuck, I just forgot to write something. So literally, if you can go click, end of the episode, go write something nice, we would be grateful, grateful, grateful. All right, guys, that's a wrap. This is yet another episode of Plastic Surgery Uncensored. And as always, I will see you next week. Your host, Dr. Rady Rahban.